My name is Jeff Fleming. I'm here with David Willcutts at 2014 RSNA. I represent our healthcare IT business for the Americas. David's with ONRAD. Let's start with just really quick overview of ONRAD and the services that you provide.
Sure. ONRAD is a full-service radiology company. We provide teleradiology services in over 30 states. We have a number of on-site hospital contracts as well, and we're continuing to expand every year.
I'm curious, ACR in August of 2013 this year came out with a report around teleradiology, and there were some varying opinions on how that should be practiced and the implications to it. You know, knowing that this is a core component of your business and the service you provide, what is your feedback and thoughts when you read that report?
Yeah, you know, there's been a lot of talk about that report, obviously, in the last many months. I think what they are focusing on are important issues to radiology. I don't think they're unique to teleradiology. We have over 70 radiologists. They're highly skilled, well qualified, and a number of them are subspecialists. And the report talked about having the right licensure, having the right quality programs in place, being able to have the right turnaround time, complying with regulations. These are all really important issues with us. Every day we focus on those things. So I really don't see it as a difference between teleradiology and radiology. And I think what the market is going to be seeing increasingly is that those two monikers are going to blend because we have to be the best radiologists we can be. That's the only way we can support the radiology groups that are our clients. We can't be somehow substandard, whether that be in how we communicate with other physicians, in how we handle turnaround time, or in our clinical quality. It all has to be top-notch, and we fully support that. So I think some of the talk around it may be a little bit of a distraction from what the core issue is. How do you take care of the patients? How do you allow the physicians to do the best job that they can?
I think it's a great position, David, and it also falls right in line with, even if you look at the meaningful use initiatives that are going on, getting more into quality with the later stages of meaningful use, regardless of where it's practiced, community, ambulatory, inpatient, outpatient. It really does come to having a consistent quality, and obviously you are well positioned for that.
Yeah, absolutely. I couldn't agree more. And it's one of the reasons why we are working with Carestream, is to be able to have that type of quality with our medical groups, to be able to communicate effectively, to be able to have images moving at the right speed and the right time to the right subspecialist. It all comes into play if you're going to really continue to grow in this market with all of the changes and demands of the market. So, you know, we think it's important. We're glad they wrote it. We're excited to be able to show that we're doing even more.
Well, I appreciate your perspective, and have a great rest of the show.
Great, thanks.
Thanks, Dave.
All right, good.